healthcare reform, such an historical bill that finally came about, and it actually has affected me personally. Back in March, I was turned down for healthcare coverage because of a minor pre-existing condition. Now, when I filed back in January to run for Congress, I had no idea where healthcare reform was going to go. I was for it, but I didn't know how it was going to personally affect me and literally thousands of others here in Kentucky when they have a minor pre-existing condition, or for that matter, any type of pre-existing condition. Now, my opponent, Brett Guthrie, wants to repeal the right that I just now earned, and that is wrong. People should have the right to be able to have access to health care. And Brett Guthrie shows that he has corporate interests, the health care insurance interests, over the people's interests. And that is wrong. I've actually talked to a lady in Breckinridge County who has a 5-year-old son that he was denied health care coverage because he has asthma. Now, this is a young mother that's worried about getting health care for her son. But just a few weeks back, you may know this too, that now children with pre-existing conditions can now get health care coverage. Now, it's also the law takes effect in 2014 to where I will also be able to have access to health care coverage because of my pre-existing condition, but a lot of people don't realize that. I still have to stay healthy to 2014, but in 2014, I, along with thousands of others that have pre-existing conditions, will all of a sudden have the right to go get that. Now, Brett Guthrie, I have to say that I don't think he really realizes how many people out there in the 21 counties of 2nd District are struggling with the cost of health care. See, that's the next thing we have to address. Right now, the health care coverage me and my wife were trying to get was going to run us about $11,000 a year. Now, I was willing to pay for it. Didn't know how I was going to pay for it, but then I got denied from it. So, if you ask me, Brett Guthrie, he needs to start standing for people and not the corporate interest when it comes to the health care reform.
What are some of the ideas you have for addressing, you had mentioned the delivery system and then also the cost. What are some of the ideas that you believe the reform what direction should that go?
Well, delivery system itself, it's kind of twofold. You can talk about the HMOs and insurance companies there. Surely there could be ways where they can help reduce costs of it, but also at the hospital level. There's a lot of different ways where they can help reduce costs. We've talked about digital records. Now if we go with digital records, there's less chance of a mistake. Also, there's other ways too. I was talking to one lady that does a lot of auditing for a lot of major hospitals across the country, and she told me of every audit she's ever done, there was at least 15% of overcharges in the audit. Now, you add 15% here, and if you can get the health insurance companies to reduce theirs a little bit, maybe another 10 to 15%, we're almost at 20, 25, 30% in reduction of cost. We're still a long ways off to being competitive with what healthcare costs in other countries like ours as well, but we've got to focus on why does it cost so much, and what can we do to reduce the cost of it. But that comes from the delivery system, but also the health insurance system itself. In fact, I would love to see a public auction. I believe with a public auction, that a lot of people would have a chance to maybe go get a cheaper rate where it's in bulk. In fact, unlike my opponent Brett Guthrie, who's going around saying that businesses today cannot make a decision next year on whether they should hire or not because of this new health care bill is going to require them to have health care coverage on their employees. Well, he's misinforming people again. Number one, that doesn't take effect until 2014. But also, it only affects employees that have 65 or more employees. Now, he's making it sound like these people can't make their budget based on what they've got to decide next year, and I've taken him to task on this in a couple of debates where he's misleading people. It's not until 2014. And his response was, well, they still need to know what they're going to do in 2014. And I think right there he's just misrepresenting what the health care bill is about and adding them scare tactics that he and the Republican leadership have always used to try to manipulate the outcome of the elections and people's view on health care reform as well.
Do you think that the Democrats have done a sufficient job in selling the health care reform bill to the public?
No, I don't. In fact, I seen that early on. I think that it's kind of like downtown redevelopment. You can look at that. I think they did a poor job of selling that to the public at first. But with that being said, yeah, I believe it was they could have did a better job of explaining it. But I also believe that our own Senator Mitch McConnell, who came here to our own hospital and spoke out against it, was misleading people and there again scaring people. You know, my campaign was always about talking about how you could trust me. We wanted to be the one source you could go to find out what's really going on, because we're not beholden to corporate interests. You know, Brett Guthrie has raised almost over $1 million from corporate interests to fund his campaign. He's beholden to corporate interests. At Marksberry, I'm sponsored by the people, and I'm for the people, and I'll always stand up for what I think is right for them. And healthcare reform was a historical first step to allow millions across the nation to have access to affordable health care.